Hello, my name's Lilly Sabri. I'm a chartered physiotherapist and we're going to be running through some exercises to both help prevent and manage hip pain from those people who have arthritic changes in their hips to acute trauma. All of these exercises are basically to help loosen your hips and strengthen all around them to help prevent any future hip pain. Okay, so all of these exercises are completed in lying and they help to both loosen the hips and also the lower back. So the first exercise is a simple knee hug. We're going to hug one knee in towards the chest to start off with, keeping the other knee bent with the foot securely fastened on the floor. If you can't quite reach around the knee, that's absolutely fine. You can use a TheraBand, which is a resistance band, or a towel, just to get a little bit more movement through the hip. Keeping that pressure on. To increase the stretch, you can actually lengthen the other leg along the mat or the floor. Keep that pressure on, and we're going to hold this for 20 seconds, breathing through it. With each breath out, you're going to feel that you get a little bit more movement. Apply even more pressure and try and get that thigh as close to the chest as possible. Once you've held for 20 seconds, you're going to hold on with just one hand. So if it's the left knee, the left hand holds on and the other hand drops off to the side. You're going to draw some small circles, getting some nice movement in that hip joint. Thinking about the shape of the joint, it's a ball and socket joint, so it's a nice circular shape fitting into the socket, and we're trying to get movement all the way round into that joint. Increasing the size of the circle as you feel more confident, and then reversing. And you want to do 16 to 20 of those in each direction. Once you've completed that, place the foot back down before moving the other one up and into the chest, and you're going to repeat on the other leg. So we're now going to stretch the hamstring muscle, which is the large muscle in the back of the thigh. There's a few options for this depending on how flexible you are. So the most simple, you're going to bend the other knee, interlock the fingers behind the back of the thigh. Make sure that the lower back is flat in the mat so that we're not pulling the back. Take a deep breath in, relax the shoulders. On the breath out, just straighten as far as you can. It may only be this far. If you can, lock the leg out completely. Now it's really important that you flex the foot. You're then going to get a stretch in the calf as well. If any of you have suffered from sciatica, so some nerve pain down the back of the leg, it's totally normal to maybe feel that that's irritated a little bit with this. If that is the case, point the foot, flex the foot, so just pump that foot. Otherwise, keep the pressure on, and you're going to hold this for 20 seconds. Again, with each breath out, just trying to increase the stretch slightly. Once you've completed that stretch, you're going to repeat on the other side, interlocking the fingers and straighten out. Flex the foot. If you want to increase the stretch, lengthen the other leg along the mat. Again, flexing both feet, pulling in. Those really flexible, wanting to get a deeper stretch, walk the hands up, attempt to hold on and keep that pressure there. 20 seconds and ease off. Moving on to the next exercise, which is really good not only for the hips but also for loosening the lower back. So the hips are so closely connected to the lower back, it's really important that we stretch out both, otherwise we're not going to get any progression with this. So if you have a ball, place it in between the knees. If you don't, a pillow is absolutely fine, and half it, fold it over. From there, you want shoulder distance apart at the knees. Place the palms facing upwards with the arms away from the body. From there, make sure that the lower back is flat in the mat. Most of us will naturally arch. Flatten that lower back, pull the stomach muscles in, relax the shoulders, take a deep breath in. On the breath out, you're going to roll the legs over in one direction. You're going to feel that the lower back comes off the floor. Totally normal. Take a deep breath in. On the breath out, roll those legs back over. You're going to pause and hold for that breath in through the nose. And on the breath out, you're going to use those stomach muscles to drive the legs back over again. Deep breath in. And on the breath out, coming back over. And we're just going to increase this stretch on the next one. Deep breath in. And on the breath out, come up and over. And then to increase the stretch, we're going to lift the upper leg a few inches higher than the underneath one. So you're going to have to take the ball out or the pillow out, lift it higher, and then allow gravity to just take you that little bit further. Anyone who's wanting a deeper stretch, place the hand onto the knee. Deep breath in, try and keep the other arm flat on the floor. On the breath out, just apply a slight overpressure down. breathe into that stretch. The only way you're going to get a deeper stretch is by feeding those muscles with oxygen. So really breathe. Nice calm deep breath in through the nose, out through the mouth. 10 seconds. Meet the feet together. Use that core to control yourself back into neutral. And you're going to repeat that stretch for 10 seconds on each side, 3 repetitions each.